What do we all care about most? Our children and families. But today, more than ever, they need us to hear them. They were struggling before COVID-19. But let's not kid ourselves. Their challenges, our challenges, have gotten bigger. The mental health crisis, the childcare crisis, the learning and workforce crisis are real. If Ohio is going to stay strong, we need to move from crisis to prevention.
Every day we have 20, 30, 40, 50 children presenting to our emergency rooms in mental health crisis. And that's one health system. These families are terrified.
Imagine if you were your child and you know something's wrong, but you don't have the expertise to figure it out, and you try to get that help and you can't.
It's not only pills, it's not only contemplating suicide or cutting.
We've expanded our beds capacity significantly over the past 4 years, but it still hasn't been able to meet the need. We still have wait lists at times for many months.
Depression and suicidal thoughts are the #1 reason any kid is admitted to Dayton Children's.
Families are very resilient, but yet they're at their tipping point.
If you look at our outcomes for pediatric cancer, they are fantastic. It's now a chronic illness instead of a death sentence. The energy, the time, the resources, the personnel, when we compare that to what goes on in behavioral health, there is no comparison. But if you look at the behavioral health aspect, it affects so many more children.
We can often see the early markers in very young children, sometimes 2, 3, 4-year-olds. I guarantee you, we see those children come back at 7, 8, 9, 10, at 11, 12, 13, and they're bigger, and their behavior's more aggressive and more challenging.
We're just seeing that these children have a hard time building relationships, and it's not uncommon for a classroom, a group, to have maybe 4 or 5 of these little challenges.
Mental health issues are an equal opportunity offender. It is rampant across all ages, socioeconomic groups, and geographic locations.
But for those children in rural areas that have more acute issues, those kids are suffering, and oftentimes they don't have the access or the ability to get to a children's hospital.
This is the health crisis of our century. This is what's affecting children and adults more than anything else.
And it's not just mental health challenges that are overwhelming families. Affordable quality childcare doesn't exist or is out of reach. That's a problem for families and for employers who need workers on the job. Children's brains develop the fastest between birth to age 5. All the research shows that they benefit from high-quality early learning and childcare.
I think about childcare every day. The cost of childcare is almost like another mortgage payment.
If I was not an employee of a childcare center, the cost would be $30,000 to $35,000 a year for 2 children.
It's very difficult to keep people in childcare and keep them employed at a living wage.
You are not going to have focused employees doing their jobs and doing them at the best of their abilities if they're worried about where their children are.
There are things we can do to make things better for children, their families, and employers. But we need sustained investment. We need to commit to lifting up families so they and Ohio can thrive.
We're going to have to invest smarter. We're going to have to invest more consistently.
Ohio has a missed opportunity. We need to invest early. We need to invest early in the right sectors and over the long term.
A lot of promises are made election time. The year before, 2 years before election time, there's no follow through.
I believe a lot of it is political will. It's up to us to speak up for our children's issues and needs.
Our government, and particularly here in Ohio, we have made certain declarations, but yet there's no strategies, there's no supports. It's okay to make the declaration, but what are the next steps?
It's really important, I think, for policymakers and leaders to understand that we need data-driven policy that really focuses on improving access to care right now for kids.
Families want things that are offered to them to be actually attainable. I see a lot of programs that are offered, but it's like, who can get into them?
What families are saying is that money is not enough. Hear our voice about the change that needs to be made. Engage us in that change. Make a commitment to see that change through.